Hello, and thank you for joining us. I am John Danig with the Clinical Research Center, and today we are sitting down with Dr. Grace McComsey, University Hospital's Vice President of Research, Associate Chief Scientific Officer, and Director of the Clinical Research Center. Dr. McComsey will be providing us with current information about COVID-19, details about COVID LongHaul Syndrome, its signs and symptoms, and what to do if you or someone you know might be impacted by this disease that affects 1 in 4 COVID-positive people. Let's listen in. Dr. McComsey, thank you so much for joining us today.
Sure.
Yeah. So you have been one of the leading researchers on COVID-19 since the beginning of the pandemic. What do we currently know about the disease?
Well, we know a lot more, right? If you look at the number of people who are dying or being hospitalized compared to the older days, like a year and a half ago, right? Well, at the start of the pandemic, I think what you see is lower number of people who are really getting sick and dying from it. And I think part of it is the vaccine. When you get vaccinated, your immunity toward it is going to fight the infection, some with you, so you tend to have less severe disease. But part of it is everything we learned about its treatment. So now we know what to do with patients. There are some treatments for outpatient before they come to the hospital or during the admission. So I would say we made a lot of progress.
So have we learned anything about how to deal with the variants that are coming out more?
Well, every variant brings a lot of concerns, right? And that's what happened with Delta and Omicron. But I would say, yes, the new variant has a lot of mutations, but so far they're seeing milder disease. So even in non-immunized, they're seeing milder form of the disease.
So it sounds like we've learned a lot over the past year and a half or so. Now that we know a little bit more about the background on it, what are some of the things we need to know? What are we trying to discover?
Well, I would say we learned a lot about acute COVID, right? So what do we do with the early illness, whether people are very sick or not very sick? What we don't know is the long-term effect, and that's what we call long hauler. I think this is still an area where we don't know much about. All we know is some people, including kids, including people who have asymptomatic disease. So basically they tested for COVID because of an exposure and never had much of symptoms or mild disease. Even those people, even kids, can have sequelae from COVID. So the NIH calls it PASC, for post-acute sequelae of COVID. What that means, that's why they don't call it long hauler. Long hauler is PASC, but when you have symptoms, so you can feel it. What we're worried about and what NIH is worried about is what happened when people recover from COVID. Is there any damage that we don't know about? Because we're not looking at specialized immunologic or virologic testing in their blood, so we don't know the extent of that. And to me, the most concerning thing with PASC is that I know kids who were immunized and they're children, they're adolescents, and they have brain fog, which is a form of PASC. So now suddenly they can't do their homework, they can't focus, they can't concentrate. This is major for an adolescent. It can really affect their life. So that's one of those manifestations of long hauler. But there are a lot more, and there are a lot of things that we don't understand yet.
Right. So I think a lot of us have read some of the articles out there, some on kids, some on adults. It sounds like it affects everybody differently, but it still can affect everyone. Are there any differences between how it will affect kids and adults?
Well, definitely less common in kids. So I would say, kids recover better, they die less from acute COVID, and they seem to have less long-term sequelae. But again, I feel like we're so early in the process, only a year and a half since, COVID, that we don't know a lot about it. We hear about cases, not just one or two, actually. There are a lot of cases in the nation of new onset hypothyroidism. So suddenly people after COVID, their thyroid doesn't work anymore. or new cases of diabetes that just happened after COVID. One lady had a new case of rheumatoid arthritis, a lady that I know. Is that a coincidence that suddenly, they have a respiratory illness and all these immune-mediated type of diseases come up? I don't think it's a coincidence. I think, unfortunately, there's a lot that we don't know yet about the illness. And some of the stuff that we're going to see may be concerning, more than just a little brain fog and then they do well. It could be something that will be a chronic disease they have to deal with their whole life.
So it could be more than the shortness of breath some people might be having. It can affect internal organs and very, very long term.
Absolutely. And that's the concern. And that's what concerns me the most, is what do we not know yet about that illness? And what's going to happen 5 years from now, where, millions and millions of people had it? Are we going to see a lot of diabetes? Are we going to see a lot more heart disease? And that's a big concern.
I think that'll be interesting, especially going into a lot of the research that's upcoming on LongHaul. So I want to get into a little bit about symptoms, a little bit more than we talked about already. So let's say someone listening is concerned that they might be suffering from LongHaul. Now that we know a little bit more about the background, what are some of the other signs and symptoms they should be looking for? And what are some of the things they can do if they're concerned?
Yeah, I think the easiest way to explain that is, we'll get to the type of symptoms, but there are two big buckets, I would say, of PASC. One is persistence of symptoms that you had when you had COVID at the start. So if people had a lot of shortness of breath and coughing during the COVID time, one of the most common manifestations of long hauler is to have this persistent shortness of breath. It gets better over time, but some people are a year and a half into the illness and they can still not exercise because they try to exercise and there's no way. They get short of breath. So I would say shortness of breath after having it during the acute phase, having it persisting months to a year and a half later is the most common, or one of the most common manifestation. The other thing you've probably heard about is brain fog, right? So brain fog, again, is something that a lot of people during acute COVID feel like, like their cognition is not, they're not themselves. They can't focus. But initially during the acute illness, all of us, when we're very sick, we have brain fog. But I think what happened is during follow-up, all the other symptoms would go away and then they're left feeling like, wait, I'm not myself. I can't think the way I was. I can't do my job. So brain fog is another one that's really concerning to people. So these are things usually that are persistent symptoms since the acute infection.
Okay.
The other bucket that I worry about is new stuff that are happening few months after COVID. So people think like, oh, great, I recovered, I did fine. And then suddenly, they start having bad things happen. And some of it is heart disease. Some of it is clotting, like in the lungs or the legs. And some I mentioned, diabetes, rheumatoid arthritis. So all these illnesses that have a high inflammation in your blood would predispose you to. And we know that acute COVID, that's the problem, right? You have this cytokine storm that we talk about, a lot of inflammation in your body. So I think, part of PASC or long hauler is that this inflammation persists. And I see it. We do a lot of studies with COVID. I see it after people recover, their inflammation markers in the blood, they don't go back to normal. They're very elevated. So I do see that, the inflammation seem to be linked to PASC, to long hauler, but we need a lot more data on it.
Right. Okay. You said there are a couple buckets here. First of all, symptoms that persist, and then new, more severe manifestations of
and new
disease.
Manifestations after the acute illness resolves.
Okay. Now, I want to go back to some of the data. I know we don't know a lot about it quite yet, but what percentage of people can COVID long haul affect? And are there people who may be more at risk than others?
Yeah. So I would say it seems like people who had severe disease will have that first bucket, that persistence of symptoms. And you can imagine if somebody was in the ICU on a breathing machine, it's gonna take them a while before they get better, right? So PASC is more common in people with severe illness, but as I mentioned, it can happen even with mild, with asymptomatic, so there is no rule. Like I couldn't predict, when I see a patient in the acute phase, neither their age or the manifestations that they have will make me predict, are they going to have long hauler or not? Unfortunately, it's a risk for everybody, even those who are vaccinated. So now we're seeing a lot of vaccinated people. They get COVID, they get it very mild, which is why, vaccinations are good. But we are seeing long hauler even in vaccinated individuals.
If someone has not tested positive for COVID, should they still worry about long haul syndrome?
Well, that's an interesting question. It depends, because some people get sick even if they were exposed to a friend or a family member who had COVID. They get sick. They kind of presume to have COVID without being tested. So these, yes, of course, it could be COVID and they could end up with long hauler. But if somebody, was asymptomatic, never got sick, lucky enough to live through the whole pandemic so far and not being sick, no, they're not going to have long hauler. So you have to have COVID infection, whether you were tested for it or you had symptoms and not got tested. That doesn't matter for long hauler.
Okay.
You can still have it.
So it doesn't necessarily matter if you have any pre-existing conditions. If you're fully vaccinated, it can really affect anybody.
It could affect anybody. I mean, I would say if you have predisposing condition, let's say diabetes, endocrinologists now are very concerned that it seems to worsen diabetes. Okay. So even if your diabetes was under very good control, you were hardly taking oral pills for it, after that, after the COVID, it seems like the diabetes gets a setback and it becomes very hard to manage. They need more medications, they need insulin. So if somebody has a predisposing condition, they should worry more because that condition may worsen after COVID. But as I mentioned, even if you're young and don't have that condition, you could still have long hauler, unfortunately. I don't want to scare people, but that is the reality of what we're seeing.
It can affect literally anybody.
Anybody, even kids.
So going back to your example about diabetes, that's interesting that it exacerbates or it makes it worse, after COVID. Have there been any other discoveries on other conditions that have been worsened because of COVID?
Yeah, a big one is cardiovascular disease, because when you have cardiovascular disease, it's linked to inflammation. So when you have this whole burst of inflammation during acute COVID, there's a lot of concern that your cardiovascular disease can worsen. So that's another concern. And everything related to having high inflammation. So lupus disease, even people who have a lot of eczema, or asthma, I mean, all these conditions, anything that inflammation is bad for could worsen a lot after COVID.
What are some of the things people can do to reduce inflammation and therefore possibly that risk?
Yeah, unfortunately, I wish I have a quick answer to that. So during the acute COVID, when people are very sick, we give medications like steroids and other medications to lower the inflammation. But these are not medications that people should take lightly if they're not hospitalized with COVID. So if they're home and they have long hauler, is there any evidence that steroids would help? Right. Studies need to be done, but we don't have those studies yet. So I would say in terms of inflammation, we go back to lifestyle modification. People, should take care of themselves. Exercise, although they have to start exercise very slowly after a bad illness because of the shortness of breath and chest pain. But they should live a healthier lifestyle than they were living before. Okay. Because all of that does affect inflammation. And there are studies showing that exercising does decrease inflammation in the blood without COVID. I mean, just regular exercise in young, healthy people, you see a decrease in inflammation. So So exercising is good, eating a good diet, probably, lower on gluten than usual, just to try to dampen some of that inflammation. It couldn't hurt. But studies on drugs to give, unfortunately, that's why we have that large NIH study that we're part of, a national NIH-funded study that will end up enrolling 20,000 participants from all over the nation, either with acute episode of COVID, and we're going to follow them for 4 years, or because they had PASC. So they had COVID, and now we're following them after the illness. So we're hoping to learn a lot about, honestly, almost every organ in their system. I mean, we have such specialized testing of every single organ they have. And I don't mean that every patient enrolled is going to have 100 tests, no, because the testing will be depending on what symptoms they have. So if somebody comes to us with brain fog, there is a set of tests that they need to get. If somebody comes with shortness of breath, it's another set of tests to try to decipher what's going on, why they have it. And we'll enroll about 1,000 patients from our hospital.
Okay.
So we're excited about it.
How long do you think the study will last?
Well, we're going full speed. We're hoping to be able to fully enroll the first year. And I know it's a lot to have 1,000 patients in 1 year. Sadly, I have to say, we have a lot of patients who are reaching out to me saying just because they heard something, in the media or on the NIH website that we're doing the study, I'm getting emails from a lot of people saying, we have PASC, or some family member has PASC. Can you please put them on the study? So it's sad to see, actually. This is a study that's not going to have a hard time enrolling. We have so many patients, including patients from other states. I have 2 other states, Michigan and West Virginia. I have people who contacted me because their states are not doing the study, so they wanted to come here.
Yeah, the interest and curiosity is there. It seems like the more communication and the more information is out there, the more people are becoming aware of, is this what I might have? And therefore they're inquiring a little bit more about it, right?
Of course, everybody feels like they're going to get COVID at some point. I mean, I think, everybody sees it so close to their home. So even if they didn't have it, a family member, a friend had it. So they feel like they want to help. They want to help understand what's going on.
So now that we've heard a little bit more about the symptoms, a lot of the long-term effects, some of the research that is going on, it sounds like we're still in the infancies of understanding the disease as a whole.
Yes.
If someone thinks they might have COVID long haul syndrome, what should they do? What steps should they take?
I think, a couple things. I would love to have people who are interested in being involved in the PASC study and the long hauler study contact me and we can get them on. But we do have at UH, at Ahuja, a large clinic called LongHaul Clinic. So basically, they're specialized. There's about 20 different specialties and expertise that's brought together to build that clinic. So they assess people, and depending on their symptoms, what's going on, what's bothering you after COVID, what didn't resolve, then they send them for different testing. So they have probably 20 different specialties, anywhere from pulmonary, cardiology, neurology, every expertise needed is available there for patients.
So they're assessing it from all angles at the recovery
clinic. Angle, and depending on the symptoms of the patients, yes.
Where can people find more information on the studies that are occurring, or even a little bit more about that clinic?
I mean, the clinic, if they look at the UH website, just LongHaul Clinic, Dr. David Rosenberg is the pulmonary physician who's the head of that clinic. It's pretty easy to find. And for our study, they can either contact me directly, or we'll have a website as well that has a phone number, email that they could contact.
Okay, great. And we'll have that website and phone number listed in the description of this podcast.
So one important aspect of the study we're doing is to ensure that we have enough diversity. And when we say diversity for PASC, right, it hit everybody. It hit African Americans very badly, Hispanics. People who reside in rural areas usually get less testing and less ability to enroll in studies. So one focus that we have is to ensure a diverse population among the people we're enrolling. So we are going to do our best to enroll enough racial diversity, ethnic diversity, as well as a lot from rural communities. So this is not just Cleveland Medical Center, people who come here. We really want to go to where patients are and enroll them in the study. And this is very important for us.
Well, Dr. McComsey, thank you so much for sitting with us and talking about COVID and long-haul syndrome.
My pleasure. Very important topic these days.
That's all the questions I had. Do you have any final remarks before we go?
No, I would say, we're all in it together. We heard about COVID. We heard that in COVID time, right, a lot. And I think PASC scares me more than acute COVID. I feel, if somebody's healthy, chances are they're going to survive the acute episode of COVID. But it's what happened after that's more concerning.
So there's more than meets the eye than the 99% survival rate.
Yep. Exactly.
You never know what happens after
and
that.
I think when people say no to the vaccine, that's one thing they should think about, is that, hopefully by having less COVID episodes because of the vaccine, we can control post-COVID or long haul.
Absolutely. And if anybody has any questions, feel free to reach out to us. You can find more information by visiting uhhospitals.org/research or by calling our COVID-19 research hotline at 440-76-COVID. That's 440-762-6843. We'll be happy to answer any questions you have. And everybody stay safe.
Right. Thank you, John.
All right. Thank you.